Okay, so we'll start off with this is our family presentation for our teaching plan. So our key findings, they pretty much just had a poor nutritional status due to a lack of intake of vegetables and fruits and a lot of processed foods due to lack of time and a busy work schedule. And their desire, they really had a desire to improve their health and well-being. They also had poor communication about family changes. Two of the kids wanted to move out of the house since they um, are old enough now, and the parents really struggle to accept this change. So our nursing diagnosis, we had interrupted family process, readiness for enhanced coping, readiness for enhanced communication, risk for family contamination, readiness for enhanced nutrition, and risk for ineffective relationships. And then you can read the rest. So for our teaching plan, we focused on readiness for enhanced nutrition. So we wanted to make sure they learned about food categories and which foods are within these. They want to learn which foods are considered unhealthy, learn about aspects of a well-balanced diet, learn how to plan to meal prep, and learn ways to combat stress-associated eating. For the teaching environment, we just did it inside the family's home with minimal distractions, but we allowed the oldest daughter to have her iPad to keep busy. So for the first objective, it was the family will increase their food literacy through explanation of why fat, sugar, and salt are poor dietary choices and importance of increasing fruit and vegetable intake before the end of the session. So we did a lecture about well-balanced diet, and our key emphasis here was that fruit and vegetable consumption is critically low in the U.S., but is the most important part of a healthy diet. And our resources we used were MyPlate. We gave them some processed food handouts and some vitamin charts, and this we took about 10 minutes to do. For our objective number 2, we made it the clients will identify potential barriers to dietary change and brainstorm ways to overcome them by the end of the meeting. We used motivational interviewing, and our main emphasis was for patients who believe that change is too difficult. Motivational interviewing can be a useful tool to help them increase how important the change in their life is. So then the research we used was a question list asking about the family motivation and their wanting to change. And we used 25 minutes for this objective. And our third objective was the clients will demonstrate progressive muscle relaxation as a technique to reduce stress-associated eating after watching the video. So we used a guided progressive muscle relaxation video, and we just had them follow along with video and show us that they could use this technique. And our main point of emphasis was stress leads to changes in eating habits that often persist even after the stressor is gone. And we used about 20 minutes. So now on to Katie.